Today, I would like to talk briefly about a major problem in health, which is erectile dysfunction in men. So let's. So, what is erectile dysfunction? We often wonder. A lot of men in various ages experience erectile dysfunction sometimes or the other in their life, and many are perplexed. Many are very worried. They are very concerned, and they do not have the knowledge as to what erectile dysfunction is actually. So basically, the inability to sustain an erection for penetrative sex is called erectile dysfunction. When the man is not able to, he's able to achieve an erection, but not able to maintain an erection or sustain an erection to be able to have penetrative sex. That is sexual intercourse, where you insert the penis into the vagina. That is known as erectile dysfunction. This problem should be for around 6 months. It should be occurring for around 6 months continuously before we diagnose it as erectile dysfunction. Erectile dysfunction can be caused by several factors. One is, physical factors, of course, mental factors, and stress plays a very big role. Psychological issues, interpersonal relations with the partner. So there are several reasons why this occurs. So sexual arousal is a very complicated process for any man. It involves the brain. So the hormones, it involves the nerves, it involves the muscles, and it involves the blood vessels. So any problem in any of these physically could cause an erectile dysfunction. For a person is very emotionally, has psychological health issues. That person can undergo erectile dysfunction if there are previous comorbidities like diabetes, hypertension, any cardiovascular disorder, or is on some medications for the same, antidepressants, anti-lipids, and psychiatric drugs, and drugs for diabetes, etc. There, one of their side effects also is sexual dysfunction in a man, which presents itself in the form of erectile dysfunction. So yes, it is age related, but nowadays erectile dysfunction can be seen between the age, even for a man of 30 to 50 to 60. It's these days it is no more age related. Once upon a time, yes, it was age related. Usually after the age of 50, you see a decline. You see a decline in the erectile function of a man. But now it isn't so. There are the various causes, even smoking, continuous non-stop smoking for decades, that causes erectile dysfunction. So obesity, that causes erectile dysfunction. So these are the primary causes of erectile dysfunction. The impact that it has on a couple is loss of intimacy. Any sexual function is for intimacy, for the couple to bond, right, intimately. So this, with erectile dysfunction, you have loss of intimacy in between the couple. That is the main impact. And it will have some difficulties definitely on the marriage and the couple's interpersonal relationship. It might affect the well-being of both the partners' mental well-being. So these are a few, how ED might affect a couple. Erectile dysfunction is a physical phenomena where the organ has to be hard enough to penetrate into the woman's vagina. So that has really nothing to do with arousal. The man may be very well aroused, but he might just lose his erection, or he might, be anxious and lose his erection, or he does not have a penis which is hard enough for penetrative sex. So he may as well be aroused. It's not necessary. And yeah, there are cases that we see that there is no arousal also, and there is there is erectile dysfunction also. But it's not necessary that the person is not aroused. More likely, the person has desire, has the libido, but has erectile dysfunction. There are many options currently that we have. First, to begin with, our oral medications. Need to consult your specialized sexual health specialist for the same, because these are all prescription drugs. Yeah, so there are oral medications which are very good. We have many good options today for both men and women for sexual dysfunction, male sexual dysfunction, or be it female sexual dysfunction. For erectile dysfunction, we have lot of good medicines which have come up, which are very efficacious, and the side effects are very low in compared to 10 years ago. So oral medications are there. Then you have sex therapy. Then you have penile injections. You have vacuum devices. Then you have intraurethral medicine, wherein we place a pill inside the urinary pipe of the man to give him an erection. And then last of all is surgery in completely cases which none of these work. Then we do a surgery wherein we insert an implant, a 2-piece or a 3-piece implant into the male organ to give him an erection. So these are the various treatments. Each of them have their own pros and cons. But the first step to treat erectile dysfunction is to find the underlying cause. What is the cause? Why has it occurred? And then once the doctor understands that, treatment is very step by step and a very systematic manner. We treat the patient, and it's always successful in most of the cases. Though erectile dysfunction directly does not have any effect on the sperm count or sperm motility or sperm mobility or anything of that sort, it does not directly cause infertility. It's like, the person is fertile when you do a semen analysis, but it can affect the chances of conceiving a child because of the inability to maintain an erection in order to perform sexual intercourse. That because the man is not able to penetrate the vagina and release the sperms or deposit the sperms in the woman's vagina. So in that way, there can be chances of infertility because he is not able to perform penetrative sex. But other than that, as individual, if he does a semen analysis, most people have perfectly normal, the reports are absolutely normal. On an average, it is very difficult to say because it is completely patient-centric. It differs from patient to patient. Treatment is often tailor-made because one person might have probably some comorbidity and due to which he has erectile dysfunction. Another patient might have erectile dysfunction due to anxiety and performance issues. Another person may be a psychiatric patient on psychiatric medicines, and he has erectile dysfunction. So depending on case to case, we tailor make the treatment plan for the patient. So, but on a roughly, if you want an estimate, it is like for medication, it will be around 8 to 12 weeks for medicines. For, sex therapy or psychological counseling, it's about 4 months with the couple or the person. And surgical treatment the surgery itself will take a day, as in not 24 hours, but probably 2 hours or something like that. But the whole process of healing and everything takes about 1 month to 45 days. So this is the rough time frames that I have given you for various treatment protocols. People who are at risk to develop erectile dysfunction due to personal behavior or personal lifestyle, many steps may be taken to prevent its occurrences. But however, many causes may not be preventable, but some lifestyle changes can definitely be made to prevent its cause. For example, eating a healthy diet, losing weight. If the patient is very obese, they will experience erectile dysfunction. So by losing some weight, eating a healthy diet, reducing the cholesterol in the blood, and then, maintain a healthy weight, exercise for just 30 minutes, 5 days a week. In exercise, you can just do brisk walking. That's about it. There's nothing else required. Not going and doing heavy lifting in the gym and all that is not required. Just 30 minutes of brisk walking 5 days a week is more than enough for a person to both lose weight and to maintain a healthy weight, and also achieve, prevent erectile dysfunction and many other diseases, not just ED, stress, hypertension, diabetes, so many things. So these few lifestyle changes can be made to prevent it, but some causes, they are not preventable. Like, you suppose somebody has hypertension genetically inherited, and due to hypertension and hypertensive medications, a person is having ED. So that's something which isn't preventable. That's treatable.